So just very quickly, a couple of slides really to get us underway. All right, so very quickly, that's a little pictorial representation really of why we're here. So, I mean, I don't need to read out all of those things, but I guess the key thing for today, the theme is sharing and learning. So learn, sharing, and really look at now how we go into some accelerated testing, because I think the next 3 months for us all are going to be quite a crucial time in this collaborative in terms of developing change ideas, strengthening the quality improvement knowledge among our teams around methodologies and tools, and really to develop strategies and plans for action over this next period of time. We're working on some assumptions, you know, that people now are very clear or very near to having their baselines established, and now it's really testing from this point on. That's just very quickly again for those who perhaps are not familiar with where we're at in the process. The Breakthrough Series Collaborative really is the short 6 to 15 month learning system. Now, we started back in probably September, October with Learning Session 0. They were regional events, and we travelled around the country to do those, and many of the faces are familiar, so you've been on the journey from the inception. We had Learning Session 1, which was our first national gathering, and obviously a lot of effort in that first quarter has gone into planning our approach, identifying harms, doing PDSAs around data itself and identifying baselines, and really doing a lot of documentation and framing, getting your teams together. So it's been a lot of formative work done to the point where we are now, so Learning Session 2. So from this point on, you know, quite a crucial period in the mix, I think, for us all. So we'll never lose sight of the aim. I mean, it is an aspirational aim. The formative nature of what we're doing makes obviously aggregating data up to a national position quite challenging, but we've got quality improvement advice on hand. So it is very important that we're able to gather everything you're doing to get to a national picture when we're asked, you know, what impact we're having, what difference are we making, what process are we improving, are we seeing any actually change in outcome. So it is aspirational, but it needs to be a stretched goal. You know, Nigel, if he's still here, I'm not sure if he's still here, you know, 0 harm. How stretched is that? Is it doable? Do we believe it is achievable? And we've arrived at this really from guidance and leadership of our expert faculty, who we convened at the very start of this process. So we don't, you know, pluck it out of an air. We get there with some robust debate and discussion. So some of the achievements. You know, I think a lot has been achieved, and we must always stop and pause, I think, and reflect on actually what we have achieved. We're sort of, we have another 9-10 months to go, but a lot has happened, and I think the teams, seeing the energy across all the teams is fabulous, and to have you all here together in one group. Teams have started using, as I said, PDSA cycles to generate more learning, and some of the teams are testing change ideas already, which is great. And it's interesting seeing the range of areas of harm and focus that are emerging. You know, you all know that there is a lot of people doing work in the constipation space, and while some might, and even me who are non-clinical, go, oh, do we really need everyone doing constipation? I'm being really honest. Actually, if that's where the harm is, if that's where the data is telling you that actually that's where the patient harm's occurring, then that's what you do. So obviously there is improvement to be made. So we have supported the teams, you know, with learning sessions. John and Prem have been diligent, and you've all been really willing in attending monthly teleconferences. They are important. It keeps you all connected in between time. DHB visits, we've started the newsletter, and the newsletter is for you all to contribute to, and really important to share what you're doing. Shared workspace and links with overseas teams. You know, we have John with us here today, and he's also supported by a number of other experts from IHI. We have had connections with a team from the National Health Service through the Halo, led by Maxine Power, and we also have a storyboard up there from Denmark who have done some work on opioids and constipation. You'll love this, the opioid bus. How can you not like that? So that just really, and it wasn't a bus ride, but obviously there were many miles that were covered. So it's and it has been, I think, from feedback from you all and through John and Prem, it has been a two-way exchange of learning. So it's really important that we are able to put ourselves in your shoes, and understand what it's like in your home base and on the ground. So it's been very good. And we will continue to build those relationships. And as we say, 15 visits, and the team, predominantly Prem and John and Avril, are keen to get round the remainder of the sites, and will do return visits if there is help or assistance or guidance required. I'm not going to delve on that because I've already sort of spoken about that, but that is all part of the collaborative. It's what you join up to, it's what we sign up to, and in partnership we're there to really work collectively. And I think one thing to remember, I suppose, and it was a conversation I had with John Kruger, the work we're doing really is, you know, it sounds a bit trite, but it is cutting edge stuff. This has not been cracked anywhere. So we are, you know, leading the way, and I think we need to always remember that and be proud of it. That's that's our theory, I suppose, and Prem, thank you, has pulled this together. It's based on a measurement system that IHI use, so I won't delve into the detail, but it does just map our vision so far, and you all actually self-assess yourselves, and we do the same with where we think we are at and the teams are at. So that's our trajectory of where we would like to get to, based on a whole lot of indicators, and beneath that marking system are a range of things that we will measure and test. So we have a theory. I'm confident that we will get there, and we all have to believe that we will. So the goals and priorities, just to ground us in today, as we've said on the agenda and in the documentation you've got, really diving and delving deeply into testing, what that entails, measurement in terms of ongoing data collection, reporting on a regular basis. There will be some expectations post-learning session too, that will start to kick in a more disciplined way. Engaging, that will continue. We have an opportunity to host some WebExes or learning sessions if there are harm groups that want to focus on something, or you as a group in a DHB. We have the ability, you know, within limits, to perhaps get IHI to run a WebEx on a particular issue, and we can do that. And of course, the capability building. We build our own collective knowledge. And on that note, I'm just going to hand over quickly to Prem. And Prem has done a lot of compiling of the data, and he's going to run us through what the early picture looks like for us all. So thank you.